the bill before you is here for a couple of reasons. But I think the best context is that the federal health care change that took place last year allows for states to obtain waivers in 2017. About 8 or 9 days ago, President Obama said he supported legislation, which is actually in Congress at the moment, that would allow states to obtain waivers from the mandate earlier, as soon as 2014, as long as they can find a way to expand coverage without clogging up health care.
My name is Dr. Eric Malmberg. I'm with the Maryland chapter of Physicians for National Health Program. I ask your support for this legislation. It will create a healthcare system for the state of Maryland that complies with human rights principles. Such a system would be universal, equitable, accountable, transparent, and participatory. Currently, the healthcare system in Maryland does none of these things. We are treating healthcare as a commodity and rationing healthcare on the basis of ability to pay.
Dr. Margaret Flowers, thank you, Chairman and Committee, for allowing us to testify today. I understand that you guys don't get enough to read, so I put together a nice packet for you, which I am not going to read. I actually want to just point out a few quick things in it. One is there's some, the first 3 pages of the Vermont bill. I think it's a beautiful statement of what a health system in a state can be. We hope that Vermont achieves that. A lot of attention has moved to the states. Over 20 states are now pursuing this approach. Also point out that there's some materials in here about Massachusetts, some very recent materials showing that that system is not performing very well. That is what our national reform was based on. And then there's a growing epidemic of underinsurance, both in the state and nationally, and there's some information about the results or what happens when people are underinsured. One is bankruptcy, but the other is delayed care and preventable death, preventable suffering.
My name is Dr. Bradley. I'm an advocate for health care for the homeless. I'm here to say that we would like you all to understand that we need support on this bill, because this bill means a lot to people who are uninsured, marginalized, homeless, poor, working class folks. I mean, you've got a variety group of people who are suffering, going to doctors, being blackballed by saying, we can't accept you, you don't have insurance. They don't care about if you drop dead in the emergency room. First thing they're coming down is with a chart and who's your insurer.
My name is Mark Schumann. I have been homeless in Baltimore City until 6 months ago. I went through a period of time where I couldn't get an ID because of complications when I was young that I won't get into. But anyways, for a long time I had no insurance and I used emergency rooms for everything because I had no choice. I couldn't get into any doctor's offices. Finally, I was accepted into medical assistance, which was great, and that helped get me. I ended up healthcare for the homeless. I got my psychiatric and physical disabilities stabilized to where I could at least try to fight my way out of the streets.
My name is James Crawford Jr. I'm with Be More Housing for All. I got hurt in an accident, and my job left the state, and I lost my medical coverage. I wind up paying, using my savings, and I wind up using my home to try to help pay for my medical coverage. So I became homeless. And I still needed medical coverage. I had needed physical and mental health coverage. And I couldn't get that. I was entitled to get coverage, and I got it finally from a single-payer program. I'm an honorably discharged veteran, and that's where I get my health care from right now. And the VA is a single-payer health care program that takes care of all veterans that are honorably discharged from the service. When I go to the VA, they don't tell me what they're going to do for me. They ask me, what do I need them to do for me? They don't say, what kind of insurance that you have. They want to know what's going on. And that's what we need for everybody.
My name is Peter Stamboulis. I've been working with Physicians for National Health Care Program for about a couple of years now. I just want to state that the lack of health care coverage for all American citizens is worse than a national embarrassment. It's a national tragedy. So many of my fellow Americans suffer needlessly and die because our nation prefers protecting the profits of an obsolete industry over the health care of its citizenry.
Yes, my name is Jane Henderson. I'm speaking as a private citizen, and I would add I'm speaking as a citizen who has health insurance. Last summer, and I really want to address the hostile consumer and irrational consumer side of the system that we currently have, which I believe will only be addressed if we go to a universal single-payer system. Last summer, my otherwise healthy, athletic 16-year-old son was diagnosed with a rare disease called aplastic anemia. It's basically bone marrow failure. After 5 hospitals, he's finally doing well. Sorry, I get so emotional. We were lucky. We had insurance. We started out in Vermont on vacation. We ended up at Georgetown and eventually at Johns Hopkins for the transplant. Pre-transplant, the explanation of benefits started showing up. Right now, I think there are stacks, 2 or 3 stacks this high sitting on my dining room table. We're blessed that for Christmas, Grandma and Grandpa gave us some money to start to pay his medical bills. The problem is, as my husband and I went back to work, trying to catch up with the backload all the time we took off, we naively thought over the holidays we would go through these bills and we would figure out what we needed to pay and what we should pay first. Naively, because we didn't understand that we now, between the two of us, had a second full-time job just going through the paperwork.
Yes. One of our doctors came up with this diagnosis. We're seeing an epidemic. It's called PIISD. It's pronounced PIST, and it stands for Private Insurance-Induced Stress Disorder. They wrote the diagnostic criteria, and they were actually published on the front page of the Psychiatric Times. They rang a chord.
Okay, thank you very much.